We are here this morning to commemorate and recognize International Overdose Awareness Day. And as you look around, you can see the faces of the folks that we have lost to overdose. So we want to commemorate them and memorialize them this morning. And you can also see the flags over here that represent the lost lives. I would also encourage us to remember their light and brightness, their smiles, the joy that they brought to your life and the community.
If you use cocaine, if you use other street drugs, you should assume that it's laced with fentanyl. And if it's laced with fentanyl, you're basically playing Russian roulette. We offer assistance, we offer Narcan, we offer fentanyl test strips, we offer xylazine test strips to determine whether the drugs that you have are safe. And we want people to understand that's available for free, no questions asked. You can contact the Department of Health to receive those. But the only way to get through this crisis is to save as many lives as we can now and to address it by trying to reduce the number of individuals who actually use drugs in the first place. And that's what our team in the harm reduction unit does. So once again, I want to thank all of them for the work that they do, offer my deepest condolences to the families of those who've lost loved ones, and hopefully what they went through and coming out and speaking to the community about the loss that they unfortunately dealt with will reduce the number of deaths in the future so that no other families have to go through it.
There's a reason why this event was designed in this way. And standing near all these signs, each one represents a staggering loss to a family right here in our community. Harm reduction is a core public health work, and we use that approach not just because it's basic humanity to treat people with dignity and preserve their health and safety however we can. We also use harm reduction because it's proven by science and our own experience to be very effective. And in the wake of all these losses, we have all come together to save the other families from these terrible losses. This is all about prevention. And we're also fortunate to have new tools available to us to prevent overdoses and death and provide support to individuals and other organizations in our community. We have to remember this, that overdoses can affect anyone in our community. There is nobody in our community that is immune from opioid overdoses or any drug overdoses at all. This can happen with regulated drugs or unregulated drugs. And we all know that unregulated drugs are all likely to be contaminated with fentanyl, which is potent and deadly. So if you did not buy your drug from a pharmacy, you have no idea what is in it, and you can just bet that it had some level of fentanyl in it.
This is a problem that we've been dealing with in the District Attorney's Office with a number of our partners in government, including the Erie County Sheriff's Department, who really focus on trying to get drugs, especially drugs like fentanyl, off of our streets. We had a man who was in his 40s who thought he was buying cocaine. He was dead in moments. But this man did not have an opioid addiction. He died because he was poisoned. He was poisoned by someone that didn't care whether she was selling him cocaine or cocaine laced with fentanyl. We're going to continue to push because while it's really important that we have days like today and we recognize the victims, it's about time that we started taking additional steps to prosecute the people that are responsible for peddling these drugs. So thank you again for shining light on this problem. We're going to continue to do what we do in the Erie County District Attorney's Office to prosecute the people responsible for putting these drugs on the street.
The gentleman that District Attorney Keane was speaking about, my family knows personally. So with that being said, every overdose is somebody. We need to treat people with dignity and respect. We need to give people the opportunity to understand that substance use disorder is not a choice, it's a disease. As somber as the day is, it gives us an opportunity to reflect on the life that our loved ones lived before they succumbed to opioid overdose.
So we want to thank you all for being here this morning. Thank you for, as DA Keane said, shining a light on overdose and its prevalence in our community and across the country. So thank you.